COVID-19 largely impacted the oncological community, and for the Western countries, starting with Europe, but now in the US, the outbreak of the COVID-19 started at the end of February or mainly in March. Then, just at the very beginning of this infection, we were able to see some reports about the cancer patients with COVID-19 infection during the AACR 2020 virtual meeting, and I think it highlights how the oncological community is organized both to adapt its clinical practice to help cancer patients to fight an unknown disease until very recently, but also how the oncological community is organized to perform research even in a field which was not our usual one until very recently. During the AACR 2020, Gustave Roussy was invited to present its experience in the management of cancer patients with COVID-19. Gustave Roussy is located in the Paris area and was largely impacted by the COVID-19. And Gustave Roussy managed 137 cancer patients in his wards. Globally, those patients were mainly female, 58%, with a median age of 61 years. The half of those patients were never smokers, with in 1/3 of the cases hypertension as a comorbidity. Patients were in good shape, 60%, with a normal BMI 24. 119 of those patients presented with a solid tumor, and the other one with an hematological malignancies. And in 40% of the cases, those patients were in remission of their disease or treated in a curative intent. At the time of the diagnosis, 83% of the patients were symptomatic, with fever as the main symptoms. 20% of the patients had a known contact with the COVID-19 patients, and the diagnosis for the COVID-19 infection was done by RT-PCR in 93% of the cases. The vast majority, 75% of the patients were admitted to the hospitals, and patients were treated with various types of treatment depending on the severity of the disease. The main endpoint for this analysis was the clinical worsening, which was defined by the need for oxygen therapy of 6 liters per minute or more, or the death. 24.8% of our patients presented a clinical worsening, and 11% of the patients were admitted in the ICU. Unfortunately, 14.6% of our patients died as a consequence of the COVID-19 infection. Hopefully, at the time of this analysis, almost 70% of our patients were already discharged and back at home. The clinical factors that were isolated as a potential risk for the clinical worsening was an ECOG performance status of more than 1, which represented a risk of clinical worsening of about 4, and an hematological malignancies compared to solid tumors with a risk of clinical worsening of 3. Gender, age, BMI, smoking status had no impact of the risk of the clinical worsening. When looking at the oncological treatment characteristics, one point to have in mind is that patients receiving cytotoxic chemotherapy in the last 3 months had an increased risk of clinical worsening by 2. Conversely, the fact that the patients received targeted therapy or immunotherapy in the past 3 months are absolutely not impact on the COVID infection. When looking at the overall survival, the only factor that remained in the multivariate analysis was an ECOG performance status of more than 1, with the risk of death increased by 3.4. When looking at the death rates of 14.6%, it has to be compared to the death rates for hospitalized patients in France or in the Paris area, which was of approximately 18%. Then, in our experience, the risk of death for cancer patients with COVID-19 was clearly comparable with the risk of death for all the COVID-19 patients. In the same times, Gustave Roussy participated in several clinical trials, both clinical trials sponsored by Gustave Roussy or sponsored by other academic institutes. And overall, more than 400 cancer patients were included in this trial, included our patients with COVID-19 infection. Then in conclusion, the Gustave Roussy Cancer Center has been impacted by the COVID-19, as many cancer centers across the world. The incidence for the COVID-19 infection was 12% in our patient population, very comparable to the global population. The vast majority of those patients were symptomatic. The death rate was 14%, comparable to what we have seen in hospitalized patients in France. And three factors have to be considered when considering those patients: an ECOG performance status of more than 1, patients with hematological diseases, and patients receiving cytotoxic chemotherapy in the past 3 months. Of course, in this field, participation in clinical trials remains very important in order to understand the best strategy for these patients. In the same session, the TERAVOLT study was presented by Marina Garacino. This work is an international work, and TERAVOLT is an international database that was set up at the beginning of the COVID-19 infection, and which aimed to collect data on patients with thoracic malignancies who contracted the COVID-19. Interestingly, in the TERAVOLT database, the sex ratio was a little bit different compared to our experience, with a lower proportion of females, 30%, but an increased proportion of stage 4, 73% of the cases. Comparably to our experience, the large majority of the patients were hospitalized in the TERAVOLT. For the patients registered in the TERAVOLT database, 73% of the cases, but the death rate was a little bit higher, 33%, which may be explained by the fact that this database is really dedicated to patients with thoracic malignancies, with a large part of advanced non-small cell lung cancer patients. Clearly, we cannot be sure that some biases are not present in these studies, given the fact that in some countries, advanced patients, especially patients with stage 4 disease, were not admitted in ICU, giving local policies. Then it may, of course, influence the death rate for those patients, which is now reported in studies. And I think that we will have more solid data in the future when we'll get I would say consolidated data with longest follow-up, and the possibility to cross-compare the data for different countries, but with more comparable situations. Interestingly, in the AACR 2020, in the same sessions, our Chinese colleagues from the Wuhan area presented their experience with 105 cancer patients with COVID-19, and they matched those patients with 536 COVID-19 patients without cancer. And the aim of the study was to try to compare and to try to assess if these cancer patients had a worse outcome compared to the patients with COVID-19 but without any cancer. And the results were quite interesting in this series because they highlighted a potential higher risk of admission in ICU for patients with COVID-19 and cancer, an increase by 2.6, and also an increase in the risk of death by 2.3 for patients with cancer experiencing COVID-19 infection. in the subgroups with the highest risk of death were those patients with hematologic malignancies. And this is something that we also found in the Gustave Roussy experience, and also patients with lung cancer, something that may explain in part the results found in the TERAVOLT database. Then I think that altogether those results gave us some insight about the cancer patients with COVID-19. But of course, once again, those data are quite preliminary for the moment.